pati pam pam pati pati pa pati pati pam pam pati pati pa pati pati pam pam pati pam pam pati pam pam pati pati pa pati pati pam pam pati pati pa pati pati pam pam pati pati pa pati pati pam pam pati pam pam pati pam pam.
2 years ago, Nkengasong and Heart-to-Heart stepped in, and they brought hope to the people of Fotabong. And that's why we are calling this project Hope for Heart. It's a narrative that says the people of Fotabong were desperate, they were hopeless, and Heart-to-Heart and BD came in and provided them hope and a promise for good health. And I think today we see that hope and a promise is being fulfilled. I was born in Fotabong to a mother who was already pretty much advanced in age. She was 55. She died at the age of 103 and died with all her senses. But because she was very concerned with my well-being, and as her only child, she wanted me to live in an area where I had more access to healthcare facilities. So I had to leave the village of Fotabong at the age of 7 to go somewhere else and grow up with my aunt. This point is important because she always, till a year before she died, she would always insist on certain things. I mean, what were some of those things? Giving back to the community, giving back to the church, and supported healthcare in Fotabong. So when she died, in her memory, I started off by doing, with my wife, Susan, to ensure that there was healthcare in the Fotabong village. And wherever my mother is, I'm sure she is very proud of the fact that her wishes are coming true.
Heart-to-Heart International was asked to work in Fotabong, Cameroon. Like all developing nations, the healthcare system in Cameroon is not adequate to serve all the people. We're working with the Cameroonian government, specifically the Ministry of Health, to improve healthcare in Fotabong. Fotabong is a very remote region, very few healthcare providers, and very poor health overall of the community. Our team works to improve health access by training local members of the community to go out to the families so that we can reach out to that individual patient to change their lives. Once we're gone, that work will continue because those community members are carrying it out.
There's a certain type of person that wants to go do volunteer work in other areas that they don't live in. And I think that those types of people already have something ingrained in them to do good, to make something better, to provide something that they have to other people that don't have it.
The joy of this day is a great day to remember in the history of the war for now.
On behalf of the war community, we want to thank our partners for the great job they have done for us.